Wow, 2024 is gone. Now we're in 2025. Happy New Year. This is for you who is on a Medicare Advantage plan that the effective date is now January 1. The time of this recording, it is January 1. So, what to know about your Advantage plan for the next 3 months? There is a very, very special enrollment period that you're actually in as we speak. Let me tell you about it. Before we get into that enrollment period, I'm going to share with you why this enrollment period exists. And the name of it is actually open enrollment period. I know it was just open enrollment period October 15th to December 7th. What is that versus January 1st and March 31st? I know. Believe me, I'm the one that does this for a living, so it can get confusing. Open an annual enrollment period. That's actually what it's called, but for sure, open enrollment period is from October 15th to December 7th. That's where you can make changes for the upcoming year to start January 1. What are we in now? It's just called open enrollment period for Medicare Advantage plans. So if you're on a Medicare supplement, skip the video. Bye-bye. If you're on a Medicare Advantage plan, this is an option to go from Medicare Advantage plan to Medicare Advantage plan if needed. So I come across a lot of people that said, I thought I wanted to stay with my plan, or maybe they didn't get the literature that said, hey, your doctors are no longer going to be in the plan anymore and you should make a change, but maybe you fell behind anyways. Now here you are, January 1, scratching your head, uh, maybe thinking you made a wrong decision, or maybe you find out late in January, late in February, after your first appointment, maybe a doctor's out of network, like I said, or a drug isn't covered. This video is for you if you're on a Medicare Advantage plan and you're looking to go into another one, whether it be one you were previously on or the one that you have been recommended by, you name it. Number one, talk with your agent. Someone like me who's maybe local to you, I encourage that. But if not, if you're looking for one, maybe you want to bounce a couple ideas off of me, there's a link in the description below. So, why does this period exist? Well, let me show you. And this is per the Kaiser Foundation. The average Medicare beneficiary, so you, the one that is on Medicare, can choose from 43 43 Medicare Advantage plans. So, and this is since 2010. This is looking at the increase since 2010. There's a slight dip, but this past year, per county, this is basically what it's saying, is per county, there are 43 plans to choose from. How the heck do you know which one to choose from? And then we scroll down a little bit, and the average Medicare, and now we're talking about standalone Part D plans. The average is 21 different plans in 2024. So why do I tell you this? Is because if you are the DIY kind of person, uh, how do you know? I mean, yeah, you can use Medicare.gov. You can type in your medications. You can type in your primary care doctor, maybe the hospitals around you, and you can get a pretty good direction. However, splitting hairs between the top three companies with the top three plans, that's where an agent comes into play. But let's just say, I mean, that's what you got to choose from, 43. If you're just doing original Medicare in a drug plan, or original Medicare and a Medicare supplement and a drug plan, 21, like you have to really sort through a lot of plans. So this is why this enrollment period exists, is if you accidentally maybe pick the wrong plan to start in 2025 and now you're looking for a different option, you have the chance. So what you're going to want to do is use the if you're going to do this by yourself, when you're filling out an application on whatever website you're on, please, it should be the carrier's website if you're doing this alone, or you can do it through Medicare.gov. So you're going to want to, in the enrollment period, you're going to want to select OEP. That stands for open enrollment period. Your effective date will be the first of next month. So if you're watching this in January, it's going to be February 1. If you're watching in February, so on and so forth, March 1. And this is only for OEP January to March. So you cannot do this after March 31st. You're going to want to select OEP, and then that's how you can move from Medicare Advantage Plan to Medicare Advantage Plan. This is the catch. It may affect some of you, it may not. When you go into another plan, your max out-of-pocket restarts. So if you are receiving a lot of medical care and you've been paying a lot in copays, maybe you had a CT scan, an MRI scan, or maybe you had an outpatient surgery scheduled for the first week in January, you've already paid up to, you name it, $1, $2, $3, $500 in copay, that will restart. So your max out of pocket is that big number. And please look at your summary of benefits. Let's rewind a little bit. If you're looking at stepping into another plan, you need to download the summary of benefits for your current plan, download the summary of benefits for the one that you're looking at, and compare them side by side. The summary of benefits is like a McDonald's style menu. It'll tell you the service on the left, it'll give you the copays on the right, and you can really, and this is also after you've verified that your doctors are in network, your specialists are in network, and that all your medications are covered. Then you can, the next comparison would be down the copay selection. Now, just to make sure you're comparing apples to apples, don't compare an HMO to a PPO. You're going to pay way less on an HMO for obvious reasons. You got to be in network. So make sure you're comparing HMO to HMO or PPO to PPO. After you do that, then you can say, all right, well, I've spent this much, and look at the max out of pockets on the summary of benefits. Going to say $5, $6, $7, $8,000 max out of pocket. Remember, the max out of pocket is not what you have to spend. It is in a year what you could spend. It caps it's actually a good thing having a max out of pocket. That's a benefit, because if you just have original Medicare with no Part C, with no Medicare Advantage plan, you have no cap on the medical outpatient side, the doctor side. So long story short, your max out of pocket will restart. If that's not a big deal, then by all means, move yourself. If you'd like to bounce some ideas off an agent and you don't have one, please contact me below. But that is the period that we are in, open enrollment period. See you in the next video.